Selective mutism affects about 1 in 140 young children, which is equivalent to 0.007%. But what is it? Can it be overcome? How serious is it? The probability of selective mutism is not actually certain due to the poor understanding of this condition by the general public. Many cases are likely undiagnosed. So, hopefully this video may change that and answer any of your possible questions. Disclaimer: this is not medical advice. If you suspect you, your child, or someone you know has selective mutism, consult a licensed psychiatrist or psychologist. According to Wikipedia, selective mutism is an anxiety disorder in which a person who is otherwise capable of speech becomes unable to speak when exposed to specific situations, specific places, or to specific people, one or multiple of which serving as triggers. Selective mutism usually starts during childhood, and if left untreated, can persist into adulthood. A child or adult with selective mutism may be fully capable of speaking or understanding speech, and does not refuse or choose not to speak at certain times, but are literally unable to speak. The expectation to talk to certain people triggers a freeze response with feelings of panic, like a bad case of stage fright, and talking is impossible. Soon, people with selective mutism will learn to anticipate the situations that provoke the distressing reaction and do all they can to avoid them. Some people with selective mutism may describe it as having a phobia of talking. So, if it's so serious, what should we do? The main warning sign is the marked contrast in the child's ability to engage with different people, characterized by a sudden stillness and frozen facial expression when they're expected to talk to someone who is outside their comfort zone. They may avoid eye contact and appear nervous, uneasy, or socially awkward, rude, disinterested, or sulky, clingy, shy and withdrawn, stiff, tense, or poorly coordinated, stubborn or aggressive, having temper tantrums, and when they get home from school, or get angry when questioned by parents. More confident children with selective mutism can use gestures to communicate. For example, they may nod yes or shake their head for a no. But more severely affected children tend to avoid any form of communication, spoken, written, or gestured. Some children may manage to respond with a few words, or they may speak in an altered voice, such as a whisper. There is no single known cause of selective mutism. Researchers are still learning about factors that can lead to selective mutism, such as an anxiety disorder, poor family relationships, untreated psychological issues, self-esteem problems, problems with sound processing, a speech or language problem such as stuttering, family history of anxiety disorders, or a traumatic experience. Selective mutism can also possibly run in families. A common misconception about selective mutism is that a child with selective mutism is controlling or manipulative, or has autism. There is no relationship between selective mutism and autism, although a child may have both. Now, all this talk about what causes and what is selective mutism, what about actually diagnosing and treating it? Left untreated, selective mutism can lead to isolation, low self-esteem, and social anxiety disorder. It can continue into adolescence and adulthood if not managed. But on the bright side, a child can successfully overcome selective mutism if it's diagnosed at an early age and appropriately managed. It's important for selective mutism to be recognized early by families and schools so they can work together to reduce a child's anxiety. If you suspect your child has selective mutism and see a healthcare provider, your child's healthcare provider may ask you your child's medical history and signs and symptoms. You'll be asked about your child's speech and language development, among other things too. However, if you suspect your child has selective mutism and help is not available, or there are additional concerns, for example, the child struggles to understand instructions or follow routines, seek a formal diagnosis from a qualified speech and language therapist. With appropriate handling and treatment, most children are able to overcome selective mutism. but the older they are when the condition is diagnosed, the longer it will take. The effectiveness of treatment will depend on how long the person has had selective mutism, whether or not they have additional communication or learning difficulties or anxieties, the cooperation of everyone involved with their education and family life. Treatment does not focus on the speaking itself, but reducing the anxiety associated with speaking. This starts by removing pressure on the person to speak. They should then gradually progress from relaxing in their school, nursery, or social setting to saying single words and sentences to one person before eventually being able to speak freely to all people in all settings. The need for individual treatment can be avoided if family and staff in earlier settings work together to reduce the child's anxiety by creating a positive environment for them. This means not letting the child know you're anxious, reassuring them that they'll be able to speak when they're ready, concentrating on having fun, praising all efforts the child makes to join in and interact with others, such as passing and taking toys, nodding and pointing, not showing surprise when the child speaks, but responding warmly as you would to any other child. As well as these environmental changes, older children may need individual support to overcome their anxiety. Sabrina Brandwood from Rochdale has had selective mutism since childhood. The condition, even in adulthood, meant she lost the ability to talk to one of her closest family members, something she greatly regrets. Before her grandmother died, she was unable to tell her directly how she loved her. Selective mutism, if not treated, can cause a tremendous impact into someone's future. So, I sincerely ask you and anyone watching this, if you suspect that you, your child, or someone you know has selective mutism, please go consult a licensed psychiatrist or psychologist. That's all for now. Thanks for listening.
Ya, itulah tadi perkongsian bersama pelajar Sekolah Menengah Sains Pendang dalam subjek Pembangunan Kendiri. Semoga dengan perkongsian sebentar tadi dapat memberikan manfaat kepada anda semua. Allahumma salli ala sayyidina Muhammad. Jangan lupa untuk viralkan video berkenaan atau kongsikan bersama rakan-rakan anda supaya kita dapat meningkatkan lagi pengetahuan kita semua berkaitan dengan apa yang telah disampaikan oleh pelajar-pelajar tadi. So, Jangan lupa untuk tekan button subscribe dan like, dan jangan lupa untuk tekan button lonceng untuk pastikan anda semua diupdate dengan video-video yang terbaru akan datang. So, terima kasih.